And now I want to start the topic of my lecture that will deep you into the main principles, methods, and all the system of working with the instrumental pulse diagnosis technique. And I know many of you personally from our on-site events, seminars, conferences. And for those who doesn't know me, let me represent myself once again. I'm Dr. Oleg Sorokin. I'm the head of Ayurvedic Association of Russia, the specialist in herbal therapy, acupuncture, and pulse diagnostics. And now we're going to talk about 7 main rules of using the VedaPulse instrumental pulse diagnostic technique. When you work with the instrumental pulse diagnosis system VedaPulse, it is important to follow several consequent steps of working with a patient. And the first thing that I always tell to my students that when you deal with a patient, the first thing that you have to do, you have to palpate the pulse of the patient by your own hands. So this is the first thing that you need to do. First, you palpate by yourself the hand of the patient, the pulse of the patient, so you could fixate or using your own clinical intuition what you feel in the patient's pulse. And only after that, use the instrumental pulse diagnosis. The real life is like this. We always need the objective methods of pulse analysis that could provide and guarantee the accuracy of the assessment, and the instrumental ways of assessing the pulse should provide those. Many of you work with the VedaPulse system for many years, and I notice on some on-site events, some conferences and seminars, that many of you do not have any smooth system, smooth sequent steps of working with the system. And now I want to provide you with this correct algorithm of working with the system. So you would be provided with the information that is maximum correct and allows you to form the individual, personified, and most accurate rehabilitation program. When I consult my own patients, the first thing I pay attention to is the level of energy, the level of prana, the level of ki energy, according to traditional Chinese medicine, if you want. This total energy level is one of the most essential things, as anything that you use to manipulate or influence the health of the patient always depends on the state of the major mediator of the body. And this mediator that carries all the influences that are aimed at the patient is prana, or level of energy. And VedaPulse allows assessing this total level of energy in a simple and objective way. In the academic module of our program, there is a spectrum tab where we can assess total power that will reflect the energy level or adaptation level, if you will. My cursor is now hanging at the TP indicator index. You can see it in the table. In modern clinical physiology, the level of energy is presented by the ability of regulation systems to adapt to the stress that body feels, or to adapt to the different pathological processes that are going on in the body. And now you see the indicators of norm of this index, and they give us this important holistic idea of the energy potential that there is in the body of the patient that came to your office. And if you see that this indicator is in the range between 1,000 to 4,000, it means that energy resource is enough to provide the, to work towards all the metabolic processes and provide the healing and restoration effects in enough amount. I want to point it out once again. It doesn't matter what method of influence the patient's health you use. Herbal therapy, acupuncture, bioenergy influence, or homeopathy, anything you use always depends on the state of prana. If the level of prana or life force is not enough in the body, the effectiveness of your influences will be drastically reduced. And if the patient comes to you and the level of energy in him is below 1,000, this state is defined as energy asthenia. And the lower the energy level is, the more vata imbalances you would notice in a patient's organism. And if you see that the energy level is hanging near 300, which is extremely low, this means that you would not be able to use the restoration resources of the body, the energy resources of the body, to heal the main disease that the patient has come to you with. So before treating the actual disease, you would have to work on the energy level. There are different ways of bringing the level energy up. The first and one of the most effective methods is pranayama, or energy breathing, and the second one is prescribing the life-providing herbs. So if I have the patient visited who has such a low energy level, the first week will be all built around these energy breathing techniques and practicing. And also I would prescribe to a patient to administer the high concentration dosages of those life force providing herbs. You all are well aware about these medicinal plants. In traditional Chinese medicine, they usually use ginseng. In Ayurvedic medicine, they usually use ashwagandha, and I prefer the other plant, astragalus. In comparison to the previous two medicinal plants, this one works on the bringing up the energy levels in the mild, soft way. And now I want to talk about the other pole of energy levels, when the energy is above 8,000. It doesn't mean that the patient has the great energy potential or a lot of energy. It means that there is a syndrome of energy stagnation. This energy stagnation syndrome is kind of a problematic situation, and to heal the major disease that there is in a patient's body, it would be difficult without solving this problem, as much difficult as in the situation of the energy depletion. This syndrome is usually associated with the imbalances of kapha pitta, and especially with kapha imbalance, because kapha dosha is very heavy in its nature. It's guru. So more kapha we have, more energy stagnation we get. In this case, usually I also take a preparation week, if I may call it like this. So during this week, I try to relieve the stagnation syndrome by using herbs from the group of bitternesses. Those medicinal plants are kind of famous. You all know them. It is the dandelion rhizome and guduchi. So the first step that we have to do is to assess the energy level, and it will determine what we will do first after that in dealing with the patient. We will be working on bringing the energy levels up, or we'll be working on relieving the energy stagnation situation. The next step that is important to do is to identify the tension level in the regulation system. Because if the tension level is extremely high in the regulation system, they will be unwilling to get influenced by all our manipulations. So the instrumental pulse diagnosis helps us to identify the stress level objectively, because you see, if we have the tension level extremely high, we will not be able to use our methods of influence effectively. So we also would need to have this like preparation week to relieve this stress situation. Another thing that is important to do is to assess the inflammation threshold. The inflammation threshold, especially in the colon, may be the base thing in the formation of majority of the modern diseases. If we see that inflammation threshold is extremely high, it is another reason why we should work on the complex rehabilitation program of influencing apana vayu in the colon. And of course, the state of ojas is essential. According to the modern views, ojas can be compared with the potency of our immune system, and in the program it is presented by the indicator named adaptation level, or the amount of energy that the body spends to adapt to the stress situations. After we get several holistic indices assessed and determined in what state the energy levels in the patient and inflammation threshold and the state of ojas, we can start the step 2. And the second step is to assess the state of regulation systems that we call doshas, according to Ayurveda. And from the point of view of pathogenesis of the disease, at what stage of the development of the disease the patient is. VedaPulse system allows visualizing the balance of Mahadoshas and get it reflected in some indicators of norm. If the dosha is in the range between 2 and 4, it means the dosha is being located in its own side, in its natural side, and it is not aroused, so it is in balance. If the dosha is in the range between 4 and 5, it means the dosha is excited at the moment and it is getting accumulated in its own natural side. Being in the range between 5 and 7, dosha is starting to leave its localization spot and start searching the weak spot, weak place in the body, and getting in contact with ama, it starts the manifestation of the disease. And range above 7 is manifested as pain syndrome and well-expressed clinical picture of the disease associated with the dominating dosha. The range below 2, meaning from 2 to 1, means the dosha is being in a weakened state. You can see here that Pitta is low, and it means that Agni is in a weak state. Being in the range below 1 means the dosha is being blocked by the other dominating dosha, who's actually literally blocks all the functioning of the dosha which is below 1. For example, you often have people or patients with overweight, but when you assess their pulse, you see that Vata is extremely imbalanced. Vata is way up of the norm. Usually, and it's very often happens that high Vata blocks Kapha dosha, and in the results of pulse diagnosis, you see the Vata domination, and physically you see the overweight. And using this moment, I would like to announce our annual course on palpatory pulse diagnosis that we have annually in August, and next August in 2020 we also have this course. We usually take the group of specialists to get the wisdom of Vasant Lad, and I invite you all to this course. The next step that I usually use with my patients is identifying the leading constitutional problem. As you understand, the constitution is determined by balance of dosha. And this concept is rather universal for all the traditional medicinal system, Tibetan, traditional Chinese system, Ayurvedic. And in this table, you see the correspondence or maybe comparison of the constitution profiles between Ayurvedic and here Chinese traditional medicine. It means that once you get to know the constitution profile of the patient, you get to know his vulnerabilities. And those vulnerabilities may trace the whole patient's life, and around those vulnerabilities, many different diseases may form. For example, on the previous slide, we saw that the person had kapha imbalance, and according to constitution profile, there were kapha vata. According to traditional Chinese medicine, this syndrome is called the accumulation of ki energy. Stagnation, sorry. These people with such a constitution profile are prone to hyperproliferative diseases. They will be prone to formation of benign tumors and cysts, and this is the major issue for them in their health. Because energy stagnation is always lying in the base of hyperproliferative states, the multiplication of tissues. And even if the patient came to you with no vivid clinical manifestations of such a problem, you would understand that and remember about this, and mandatory, including your complex rehabilitation program, the influences on this very thing. And if the person comes to you with constitutional profile of Vata Kapha, you understand that there are problems with Agni levels. In traditional Chinese medicine, it is considered as deficiency of Yang. And such people would be prone to digestive disorders that would usually lead to skin atopy. And those patients would come to you with skin disorders. But you, understanding the very root of the problem, would work on the Agni levels. Having determined the major vulnerabilities in the body's patient, determined by his constitution profile, we will be working and analyzing the changes in Agni Dhatu. The level of Agni Dhatu we may assess on the 5th level of the pulse in Palpate analysis or by the Nidana module of the instrumental system. And the combination of low Rasa Dhatu simultaneously with the tension of Rakta Dhatu usually shows the pathognomic situation determined by the presence of Ama in those tissues, in those Dhatu. You all know the Ama concept very well, and you know that Ama is no toxin. Ama is the metabolic intermediates that for some reason are not expelled naturally by the body anymore. And if it happens, if dosha is imbalanced or there are distortions in regulation systems combined with ama accumulation, it all leads to formation of the disease. And our task is to break this connection between dosha's imbalance and ama. But it is not always that easy to expel those metabolic intermediates from the body right away. It always depends on the state of those intermediates in the body. And using this moment, I want to announce the course that we usually have with Professor Ram Manohar, who is giving the great information of basics of Ayurvedic principles, and he usually outlays Ama concept in a great way to give you all the information needed on the protocols of treatment. So this is the very step, the main step, where we actually face the actual disease of the patient. And analyzing the organ pulse on the 1st or the 7th level of the pulse according to Vasant-Lat system, or using the instrumental pulse diagnosis, we identify the state of the disease. So in front of you, there is a card of the patient, a woman who has endometriosis. So what features do we have here? Here we have this unique combination of the situations in 3 channels. 8 channel that is associated with kidneys, 10 channel that is associated with endocrine system, and 12 channel which is associated with the liver. At the same time, in the Nidana module, we see the tension in Apana Vayu and chronic distortion from the side of Ranjaka Pitta. This unique combination of features clearly shows the violation in the functioning of reproductive system, which clinically manifested in this patient as endometriosis. So only in the stage 5 or in the 5th step, we start dealing with actual features of disease being present in the body, assessing it by the pulse, actual pulse, or by objective indices of instrumental complex. And here I would like to introduce to you the course that was developed specially for our specialist and is held by Dr. Narayana Nambi on Kaya Chikitsa, or Ayurvedic therapy of internal diseases. The second step is to assess the features of Prakruti-dependent or Prakruti-determined tendencies that may form some pathological processes. You understand that we assess the Prakriti on the 7th level of the pulse, and instrumental pulse diagnostic complex allows with mathematical algorithms of bioinformation get the probability of genetic deviations. And this algorithm helps us to see the mathematical probability of polymorphism of gene that may trigger the development of the disease. So here in this table, you see the genes in their international nomenclature and the mathematical probability of the violations in the state of the genes in the point system. So if you see that gene is being marked with more than 200 points, it means that epigenetic mechanisms that are there to compensate the probable distortions in the functioning of the gene do not work sufficiently. And this particular gene is responsible for gluten enteropathy that usually triggers the autoimmune hypothyroidism. And the last step is all about building the complex rehabilitation program. And I always say to my students that if you want to become a real doctors, you need to possess 4 main competences, 4 professional competences. The first thing that you have to be able to do is to build recommendations on lifestyle or dinacharya. And VedaPulse allows you to generate automatically the recommendations on lifestyle that you will go through with your patient. And the second step is to build the constitution-based diet that is all built on Ayurvedic principles. And also after that, after analyzing the pulse on VedaPulse system, the program provides you with a list of products that are not that are contraindicated for usage. The next competence is the prescriptions on life-giving herbs, and in VedaPulse program there is the rehabilitation module called Herbal encyclopedia. This program compares the state of doshas, the gunas of the doshas that there are in the patient, with the constitution of the plant, and provides you with the recommendations. The next competence is associated with influencing the life points of energy flow, which may be associated either with acupuncture or with marmotherapy. Only after a 5-minute assessment of the heart rate on the VedaPulse program, the program provides you with the comprehensive recipe of influencing the energy points to balance the situation. For this, we use a module that is called Acupuncture. To conclude, when you work with the instrumental pulse diagnosis program, you should follow the certain system or steps. I presented you the 7 rules of working with instrumental programs that has been generated based on my experience, and not only my experience, but also experience of other specialists. So to conclude, I want to welcome you once again at our first international online congress on pulse diagnosis, ProPulse 2019. And I want to wish you the successful getting of wisdom from our specialists. And I give the word to the next expert.